I'm Dr. Buonassisi. I'm a facial plastic surgeon, and I'm part of a team here at 8 West Cosmetic Surgery, where we do both surgical and non-surgical facial rejuvenation treatments. This video is part of a series where we talk about periorbital rejuvenation. This includes brow lift surgery, along with upper and lower blepharoplasty. In this video, we're going to talk specifically about lower lids. Lower eyelid blepharoplasty is a surgical procedure where we reshape the lower eyelids, either by removing some of the fat, rejuvenating the groove underneath, or by tightening the structures of the lower eyelid. A candidate for lower lid surgery is someone who has either looseness of the skin that can be reasonably tightened, they've got bulging of orbital fat that can be removed, and someone who has reasonable expectations for the degree of improvement that can be achieved. It's very important with the lower lids to maintain the lower lid position and function. And this is something that I think for many patients, they may not realize that more surgery on the lower lids is not necessarily better. And I think to be very cautious and maintain the function of the lower lid, maintain the position of the lower eyelid itself is extremely important. And I think being conservative with lower lid surgery is very critical. What's great about the minimally invasive procedures that we do for the lower lids, particularly the transconjunctival approach, is that it can dramatically improve the bulging of the lower lids beyond what we can do non-surgically. It also has a very, very low propensity to change the shape of the lid margin, and there's no external scar. So I think it's probably the most common surgical procedure for the lower lids that I recommend. It's not the perfect procedure for everybody, and not everybody needs it. But I think that overall it's a very successful and very sought after procedure in our practice. The three main techniques that we think about when doing lower lid surgery are a transconjunctival approach, where we go through the inside of the lid, and that's aimed predominantly at removing fat or possibly removing it and transferring it into the cheek. But that requires no external incision, and I think that for most younger patients that works really well. The other techniques include an elevation of the skin, which does require a small incision along the skin, along the lash line. And as our patients get older, or if people have a lot of looseness to the lower lid skin, then that approach can be very helpful. With either of those, the fat that is sitting underneath the eye or within the lower eyelid that bulges forward, that fat can be repositioned into the cheek through either approach. The benefits from lower lid blepharoplasty, above and beyond what we can do non-surgically, really are the permanence of the results. So in a patient who's got a lot of orbital fat, removing that fat is a permanent treatment. That fat doesn't come back. And I think that the long-lasting result and the fact that you don't have to camouflage that fat, you're just removing it, I think is very attractive for patients. So I think long-term, it can be a very good procedure for people who genetically have a lot of bulging of the lower lids. And so it's very popular for that reason. Recovery from the transconjunctival approach is pretty quick because there's no external incision. People usually go back to doing sedentary work within a couple of days. I think with the approaches where we're actually making skin incisions, I think the bruising is more significant, and also there's going to be an incision line that people can see. I would say that the recovery from that is more like 7 to 10 days. The common non-surgical treatments for the lower lids really involve camouflaging some of the bulges and grooves. In a patient who's got a fairly subtle bulge and it causes a bit of a groove underneath, that groove can be filled with hyaluronic acid, and I think that can be very successful. Small, fine wrinkles along the lower lids can be resurfaced with a laser, and then some of the expression lines which form along the outside or the crow's feet areas can be treated with neuromodulators. So those are sometimes things that we do even with our patients who have surgical procedures on the lower lid. So there's lots of different treatment options for the periorbital areas, the brows, the upper eyelids, and the lower lids. For some people, the non-surgical techniques are enough that it improves the area to the point that they look great. And in others, if they're periorbital aging or some of the contours are a little bit more prominent, sometimes surgical procedures might be more beneficial for them. But it's really a conversation that we have with all of our patients. We offer non-surgical and surgical approaches, so we can give them our best advice and then allow our patients to decide what works best for them at their particular stage.